Good morning. Everyone, please take the package. Make sure you guys have a skeletal for Spiderman and infection control. I like it just to show you guys infection control, very important for your exams, and everyone should know good infection control. And since I'm going to do this package, a Spiderman package, and on the first page is a lot of isolation. And I give this package also, very simple, and I will show you, and as I will move on a little bit on infection control, guide you how we need to know. You've got to know the diseases, you got to know where are you going to put them in isolation. Now, Spiderman package, those who have never done it with me, is a combination of all the system. Everything is in there. And I like it, a Spiderman package, whenever you're writing on there, keep it with your folder. Because before you are taking exam, I like you guys to go over this Spiderman package. And make sure not only knowing, and you can say, I can memorize everything, but it's only one line. And I want you guys to know that it's not a line, but you need to know the good about that disease. And I will be talking a lot. I won't only read one line, and I will explain a few things, and I'll give you guys time so you can add things there, make a little notebook, and start writing separately about the Spiderman package. So you're not going back in each system. You've got to memorize. You've got to connect the information. So I will start with page number 1, and this is our Spiderman package. And it says, do not delegate. We all have learned what do we do as a LVN when you have your license and you are delegating. What is the delegation you're going to do? To CNA and UAP. Remember the word UAP? Unlicensed assistive personnel. So when you are delegating somebody, you're still legally responsible, the work should be done. So what do you need to do when you delegate? Number 1, evaluate. It says the word eat on the first page. Evaluate, assess, and teach. What is the meaning evaluate? Meaning evaluation is you must know whether the person can understand. Can she do this job or not? And what do you need to help her to understand what you want the work to be done? So what is the meaning evaluation? The knowledge of the person. And you are going to see, assess. Your patient is going for some tests, and this CNA and UAP is not aware, you got to teach them. But you got to evaluate the knowledge of that person. That is called evaluation. Number 2, assessment. Yes, you assess your patient, assess with your UAP, and teach them. So remember the word evaluation, assessment, teaching is ongoing all the time. Whether you're teaching your CNA or you're teaching your patient, you got to evaluate, you got to assess, and you continue teaching all the time. So it's important wording as we move on. Now I will go on. It says Addison and Cushing. Now you guys have done, we did endocrine. Some of you may not be here. But my point here is we must know what is Addison, what is Cushing here. Now what this goes in what system? Endocrine system. What gland is affected and what is the gland is responsible for Addison and Cushing? What is the gland? Anybody remember? Adrenal gland. So I want you guys remember, so I will talk first Addison. And what gland we are saying is the adrenal gland. And what part of adrenal gland is? Cortex. Very important that we must know the part is the cortex. Adrenal gland has 2 parts, cortex and medulla. So when we are talking about Addison, we must know Addison disease is from what gland? Adrenal gland. What part of adrenal gland is? The cortex. And what is adrenal gland is doing in our body? Very important that we know what is the function of the gland. Anybody knows what is the adrenal gland is responsible to? Producing, we say the word is steroids. But what are the word I want you to remember, not only the one steroids. We all know the word steroid. What is it it's producing is glucocorticoid. Everyone make sure we know glucocorticoid. Mineral corticoid. Androgens. Those are important words because a lot of time when you will see the question, patient is taking glucocorticoid. The meaning is patient is taking a steroid. So what is a glucocorticoid, mineral corticoid, and androgens are from adrenal cortex. Everyone is okay? And what happened in Addison? It says here the word down, 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 but I will write down and I want you to memorize like that. So everyone, when you see Addison in your mind, what is Addison disease is? The adrenal gland. What part of adrenal gland is the cortex? What is it producing here? The steroids. And what are the steroids? Are glucocorticoid. Very important word. Without these wording, you will not be able to know because your drugs, they will say glucocorticoid, mineral corticoid, and androgens. Now what happened to the other wording is steroids is good. Sometimes they use the word cortisol. And I want you guys to make sure when you see the word cortisol, they're addressing for the steroids. Now what happened to the patient when you have Addison? So I'm going to write it down. What is in Addison here is number one, is they have low sodium, low sugar, and low blood pressure. And what is high here is the potassium, and what is high here is the calcium. Everyone is okay? This is the way we got to memorize here. Now you do have up and down, all that, but you can write it like this. So you will memorize all the time. Is what is low here is sodium. What is low here? Sugar. What is low here? Blood pressure. What is it high here? Potassium. What is high here is calcium. Now what is adrenal gland is doing? Let's memorize that. Is number one. What is sodium and potassium and calciums are? Electrolytes. So I will write here, adrenal gland is responsible for electrolytes. What is this is here? Your vital sign. Are we clear? So blood pressure or vital sign may be in your question. Now let's memorize adrenal gland is responsible for what? To maintaining your electrolytes and maintaining the vital sign. Anywhere question comes, adrenal gland, removal of adrenal gland, Addison crisis, immediately we know what are we looking for, electrolytes and the vital sign. Now what is high here, which is not too good for your patient, is potassium. And what is low here is sugar and very low sodium. These are not good. Patient is coming in, his blood pressure is low. Question, patient, you're a nurse, you're admitting Addison patient. What would you monitor as a nurse? Simple answer. What do you monitor here? The blood pressure. Maybe the answer is what? The vital sign. So remember, first thing is what are we monitoring here? The blood pressure. Second thing is Addison patients are losing weight. You've got to monitor their weight. So remember, they're losing weight. What would you teach your patient who has Addison disease? What would you teach your patient here? Number one, you prevent them from a stress. So what would you teach them? Avoid a stress. That may be your question. Because if they go in a stress, their steroids are very low. And so number three, I would say everyone remember the word, what are we avoiding here? The stress. What are you teaching patient to avoid? A stress. Now what happens if they're going in a stress? Anytime when we get sick, we are going for surgery, your body needs more medication. Are we clear? So stress, infection, surgery, but a lot of in your question would be, what would you teach patient who has Addison disease to avoid what? a stress. How are you treating them? Next is, I want you to write down, how do you treat them? Number one, lot of question maybe you're treating them by what? Mineral corticoid. And another drug they use is called Florinef. So write down the word. How do you treat them? By steroids, but they may use the word mineral corticoid, or they're treating by Florinef. Everyone is okay? So how do you treat them? By giving mineral corticoid and Florinef. So what are these mineral corticoid? And remember the word here, mineral corticoid. So they are steroid. What would you teach your patient when you're giving steroids? What do we teach our patient when you're giving steroids? Anybody remember? What do you teach? Don't stop all of a sudden. What do you have to do? You have to taper it down. So it says here mineral corticoid, Florinef is the medication, Florinef, Florinef. These are both are steroids, but half of your questions are, when you're going to practice your question, what would you treat your Addison patient? Answer maybe Florinef, maybe mineral corticoid, maybe you're giving us steroids. What would you teach your patient here when you're giving us steroids is do not stop all of a sudden. What do we have to do? Taper it down. Now what happens if you stop it? Patient is going into what? Crisis. So remember, is do not stop the medication. So your teaching is going to be for medication. Now remember, these are the patients are going in Addison or adrenal crisis. Now when you are giving us steroids, what are we turning our patient into? Cushing. So remember, number 6, you added, you monitor for Cushing. I'll be talking Cushing separately, but remember, what are we monitoring patient here? For Cushing. Everyone is okay? So what are the main thing I said? If you remember that one, we are going to do very well our question. And you don't have all these things written. That's why I expect you that we got to memorize. You got to make a notebook. You're not going to go back and forth each system. So you got to know is Addison patients are what? They have low steroids. And what is the word I said also to know? The word is cortisol. What is the part of adrenal gland is affected? Is the cortex. And what is the adrenal gland is producing? Is everyone should know the word glucocorticoid, mineral corticoid, and androgen. Now what is Addison? All the steroids are low. And what are these patients are lacking here? In your mind, without our books, is number 1, they have very low sodium. They have very low sugar. And what is the patient's blood pressure? Is very low. Patient is coming in. What are we going to assess here? The blood pressure. What are you going to monitor in the lab? Electrolytes. Remember, you're going to monitor the electrolytes. What would you teach your patient here is avoid the stress. Everyone is okay? And what would you teach also? Not to stop their medication. And you're giving them steroids. And why? If they stop the medication, or they're going in a stress, or they get infection, they're going into what? Crisis. Everyone is okay? What is crisis would be? What do you think the word crisis? Same thing. Patient is going, everything would be more worse. It's going to be much lower. That means their sodium is extremely low. Sugar is extremely low. The blood pressure is low. When your blood pressure is low, what word we call here is the shock. So remember, the patient is going into shock, and we are monitoring the sodium, we are monitoring the sugar, but remember, potassium is not good for the heart. And what would happen here? The potassium level will be extremely high. How would you treat your patient? So remember, adrenal crisis, I'm saying few words here. We got to connect. We cannot just think one word and we can't think the other wording. So what do we remember here is we monitor our patient when they're going in crisis in what? Shock. Are we clear? What happened in shock? The blood pressure is very low, sodium is low, sugar is low. What is high here? Potassium. What would you do as a nurse when your patient is in crisis? Anybody? What we will do? What can you do when patient is in crisis? Number one, you got to give the medication. And what are we going to give here? Steroids. And how would you give steroids are, write down the word IV. What do you administer here? IV steroids. Are we clear? And what would you give? Their sugar is low and their sodium is low. We are going to give IV fluids. And what would be the sugar word is called? Dextrose. So remember the word IV, dextrose. IV normal saline. And monitor your patient vital signs. So got to replace things to make your patient come to the normal condition. So this is the way we need to know. If you know this, the way that will be, you're doing much better your question. So everyone, Addison disease is from where? Adrenal gland. What part of adrenal gland? Cortex. And what is the cortex is producing are steroids, which are called glucocorticoid, mineral corticoid, and androgens. What is low here? In our mind, sodium. Lot of question would be, patient has Addison, what would you teach your patient? Avoid too much exercise in the sun or outside. Why? You will sweat more, and what would you lose more? Salt. Patient salt is very low. Patient is craving. And what food you will give? Anything containing more salt, more sugar. They have no restriction here. This is very low here. And what is high here is the potassium. And so these are your questions. What kind of skin on Addison patients we have is pigmented skin. Some of your question would be on the skin. I want you to add their pigmented skin or bronze skin. They use the word bronze skin or pigmented skin. Bronze, B-R-O-N-Z-E-D, or pigmented skin. And they're losing weight. How are we treating them, Addison patient, are by giving glucocorticoid and mineral corticoid. They can give, a lot of question can be mineral corticoid and flurinap. What is low here? Everyone remember the word cortisol is for steroids. Everyone is okay about Addison? I'm going to move on Cushing now. So this is opposite. So this patient is going to turn into Cushing, but when they're asking you Addison, remember the word Addison and Addison crisis. I will be talking about Cushing now. Cushing is totally opposite your Addison disease. Again, what part of the adrenal gland? What part of the adrenal gland Cushing is? Same, adrenal cortex. What hormones do we have here? Glucocorticoid, mineral corticoid, and androgens. I'm writing the same thing back here because of Cushing. We have two diseases with adrenal cortex are Cushing and Addison. Let's know a little bit about Cushing disease. Now what would happen if a patient is with Cushing is they have too much of cortisol. So write down the word, too much of cortisol. Too much of steroids in their body. And maybe the word is cortisol. What would be the problem with the patient would be here. They have high sodium, high sugar, high blood pressure, and what is low here is potassium, and what is low here is calcium. Now remember, what is the hormones? Androgens are affecting the sex hormones too much. And that's why they have the characteristic. How do you look? How does Cushing patient look? You all know. Moon face and buffalo hump. Are they changing the voice? Yes. The female voice gets more harder and like a manly voice, and they use the word hysteresis. And that is the changing in their voice and there. Now, Cushing patient has more sodium, more sugar, more blood pressure, and low potassium, and you have what? Low calcium. Now, immediately, we know they have too much of steroids. Second thing, remember, they're gaining weight. Adolescents are losing weight. Next word, I said, remember, they have high cortisol. Don't forget that. Question, patient has Cushing. Isolation. Where are you going to put your Cushing patients are? They have low resistance. Reverse isolation. If you guys look on your page, and you guys have a reverse isolation on this page. And if you will see on the page with isolation, highlight the word reverse and highlight the word Cushing. And why reverse isolation is here? Because when you are taking more steroids, a patient has a more steroid, the resistance for infection is high. So what do they have here? I will write down is here is the low resistance. Are we clear? And remember the word reverse isolation. You've got to keep important thing in mind. As we think about Cushing, thinks about too much of steroid, a patient is going to be in what precaution? Reverse. You are protecting the patient. Are you going to place them with somebody who has infection? No. So remember, if you have a question and you have people who has infection, pneumonia, and other, you're not going to put anybody with who are taking a steroids or with the Cushing person. So that's number one in your isolation. What is the next thing you will think to monitor? I'm going on a key wording. And if we remember the key wording, we will do better. So first thing, everyone is okay. Cushing is too much of steroid. What do they have high here? Sodium. What do they have high here? Sugar. What are you going to monitor your Cushing patients are? Number two, hyperglycemia. What would you do for your patient here when they have hyperglycemia? You are monitoring their blood sugar. What would they need? Insulin. Maybe on your answer, what do you give them are the insulin. What are you monitoring for your patient? For acute check, you're monitoring their sugar level. Are we clear? Maybe let me reverse the question, another one. Patient is taking a steroid. Patient was never been diabetic. Patient started a steroid and patient says, why my sugar is going up? Your answer would be because of your medication, your blood sugar is going high. Everyone, remember, your questions are not straight. We got to connect it, and we got to think when patient is taking a steroid, the blood sugar is going to be high. Cushing patient has what? Here is too much of steroids. Their sugar is high. Are you going to monitor their blood sugar? Yes. What is low here? Calcium. What would be the question on calcium? We are nurses. Number three is, what do we call when you have low calcium? Osteoporosis, pathological fracture. We already know this patient's steroids are high. This patient is going to be risk for fracture. So remember, maybe risk for, and they use the word pathological fracture. That means because of steroid, we already know that's a risk factor, and patient is going to have fracture here. So what are we monitoring here? Pathological fracture. What would you teach your CNA? The questions are not there. What would you monitor? What would you tell your CNA if you have a patient who's already having high steroid and they're taking high steroids? What do we do here? Turn your patient carefully. Ambulate with assistance. Handle them gently. Are we clear? So your questions are, how do we handle our patients are by very careful handling. They're very risk. I had seen patients, those who have been in a steroid, without even getting them out of bed. I had a patient and she was laying in a bed, only she was very restless. She had a brain tumor and she was hitting her leg all the time with side rails. Even we had side rails padding, and she had a fracture right here on the femur bone. And what was the reason? Because she was on a steroids for months and months. And so remember, and when we have a fracture in a patient, nurses are number one. Everyone will question you why your patient had a fracture. And we are very much responsible to take care of our patient. So our questions are more prevention. Patient is Cushing, patient is taking a steroid. Number one, they're very risk for fracture, very risk for hyperglycemia. Everyone should know those are very important. Now they're gaining weight in Cushing patients are. Now remember, is healing process is very low. Questions are, what is the meaning healing process? Wound care. Prevent them to have more wound. Patient come back who is Cushing. Patient had surgery. What would you do when you're doing the wound care? Question here. What do you do when we are doing the wound care? When we are removing the dressing? We got to be careful. Their skin is very fragile. What happens? You pull the tape and you have a skin tear, or you have abrasion here. It's not going to heal. So your questions are, how do you remove the tape when you're going? You go towards the suture line. Are we clear? Go towards the wound and make sure you're preventing your patient not to get. So you got to keep all this information when we are thinking about the patient, not as a book, what Cushing is and memorize, but what do we do for our patient here is a good wound care. If they have a wound, it will take a longer time. Patient has stage 3 wound. I'm not talking about Cushing. Patient is on steroid. And they're asking you, what do you expect here? The patient wound is not going to heal. It will take a longer time for healing process. So remember your question, wound care. Number 5, prevent a skin care. What would you use for prevention skin breakdown? Maybe a crate mattress, maybe air mattress. So I will write it down on a skin care, a crate mattress, or remember a special mattress for your patient. Number 6 is bruising, the risk for bleeding. Our steroids cause a lot of bleeding problem. So when you have more steroids and patient has bruising, why? Because they're risk for. So we are monitoring for any kind of bruising. And if you're giving a steroid to your patient, then you got to give with the food. Why? Because it causes GI bleeding. Now, everyone should remember in Cushing is number 1, what isolation I said? Reverse isolation. What did we move here after reverse isolation? Hyperglycemia. Bones are very weak. The skin care is important. Special mattress is important. Wound healing process is very low. Patient is risk for getting infection. And skin breakdown, you will monitor for that, giving them this. Because they are huge on the top and they have legs which are very, very skinnier in the lower part. So what do we have to do here? The clothing. What kind of clothing do you give them are the loose clothes. So keep that in mind, the loose clothing. Now let's go in a diet question. What diet do you think are we going to cut down here? Remember, they have very high sodium. They have very high sugar. You're going to monitor, you're not increasing sodium and you're not increasing more sugar, and your monitoring is there. What is low here? Potassium. What do you do for low potassium? You increase potassium in the diet. Everyone is okay. What do we increase here? Potassium in the diet. They have calcium. You can increase calcium. But remember, you're not doing anything more with the sugar and sodium. What would be management for Cushing would be controlling their blood pressure. So you're giving blood pressure medication. Whenever you're giving blood pressure medication, what do you monitor for your patient? Orthostatic hypotension. Everyone is all right? Then what do you monitor? Patient here is very low potassium. You do need to give them the diuretics. What kind of diuretics are we going to give them? Potassium sparing. What is a potassium sparing diuretic is? Anyone remember potassium sparing diuretics? Aldactone. Very good. Aldactone. So remember, you want to save the potassium, and you are not giving any Lasix, you are not giving other diuretics which you are going to lose the potassium. So we are covering is Addison and Cushing. And what do you monitor? Again, the blood pressure here, monitor electrolytes, but very important, your reverse isolation. So we covered Addison and Cushing. Now, in the second two line, you have Addison and Cushing, so I won't go, we already talked about it. Underneath, you have the word no P, no potassium. In the next line, make sure we all know what is the meaning potassium is. When you know P, what does it mean? The kidneys are bad, renal failure. When you pee more, remember simply we are losing potassium. When we don't pee, we retain more urine. What would be high in the body is the potassium. Are we clear? So what is it?